Dr. Walt here with 5 numbers you need to know to dramatically reduce your risk of premature death. Who wouldn't want to know this? You remember Celine Dion sang the theme song for the movie Titanic, and she claimed, "My heart goes on and on." Well, today I'm going to show you how you can help your heart go on and on.
Today, our health includes our mind, our body, and our spirit. Separating medical facts from fiction is the key that leads to wise decisions about our health and well-being. Unpacking the latest research is vital. Doing what works helps us live our best lives today. How can we live longer? How can we live healthier? Let's ask Dr. Walt on Liftable TV.
Hi everyone, I'm family physician Dr. Walt Larimore, and I'm delighted that you're taking the time today to join me in my office to chat about your heart health. The main function of your heart is to keep blood that's full of oxygen circulating throughout your body. Because your heart is crucial to your survival, it's important to keep it healthy with a well-balanced diet and exercise and avoiding the things that can damage it, like smoking and stress and worry and anxiety and poor nutrition. But I thought we'd start off today with some fun facts about your heart that you may not know. The first one is that the average heart is the size of a fist in an adult and will beat about 115,000 times each day. Your heart pumps about 2,000 gallons of blood every day, and if you were to stretch out all of your blood vessels, they would extend over 60,000 miles. The first open heart surgery occurred in 1893 and was performed by Dr. Daniel Hale Williams, who was one of the few African-American cardiologists in the United States at the time. And the first implantable pacemaker was used in 1958. Arne Larson, who received the pacemaker, lived longer than the surgeon who implanted it. The youngest person to ever receive heart surgery was only a minute old. She had a heart defect that many babies don't survive with, and her surgery was successful. And the earliest known case of heart disease was identified in the remains of a 3,500-year-old Egyptian mummy. Now, most heart attacks happen on a Monday and Christmas Day. And it's just surprising to me that that happens. Anyway, it's also possible to have a broken heart. It's called broken heart syndrome, and it can have similar symptoms as a heart attack. And then, I love this one, laughing is good for your heart. It reduces stress, and it gives a boost to your immune system. But heart disease is no joke. According to the CDC, heart disease is the leading cause of death for men, women, and people of most racial and ethnic groups in the United States. In fact, one person dies every 36 seconds in the United States from cardiovascular disease. The Center for Disease Control and Prevention tells us that about 655,000 Americans die from heart disease each year. It's 1 in every 4 deaths. And although heart disease is sometimes thought of as a man's disease, almost as many women as men die from heart disease in the United States each year. And heart disease is a killer that strikes more women than men and is deadly as all forms of cancer combined. You hear that, ladies? Heart disease is more likely to kill you than all the forms of cancer combined. Most of my female patients worry about breast cancer. And while 1 in 31 American women die from breast cancer each year, heart disease is the cause of death for 1 out of every 3 women. It's a huge factor for women. So what puts you at the most risk for heart and cardiovascular disease? Well, of course, high blood pressure, high blood cholesterol, and smoking are key risk factors. But there are also some others that I think you need to be aware of. So obviously high blood pressure, high cholesterol, worry about that. But some others that you need to think about are some of the medical conditions and lifestyle choices that can also put you at a higher risk for heart disease. And some of those to at least think about: diabetes, being overweight or obese, an unhealthy diet, lack of physical activity, we call that sitting disease, and excessive use of alcohol. Now, here's a way to think of it. When it comes to your car, every one of you know that preventive checkups like checking, the tire pressure, the oil, the depth of your tire tread, the balance of your tires, and all the vital fluids. All of these checks allow your vehicle to run smoother, last longer, travel safer, and it can save you a lot of trouble, a lot of time, a lot of money. And the same is true for your body, especially your heart. So today, I want to tell you about the 5 checkups, or the 5 numbers, or the 5 letters, the 5 things you need to know to keep your heart from blowing out, burning out, or becoming flat. Well, according to a study published by the Journal of the American Heart Association, the number of people with an ideal cardiovascular health score has dropped from 8.5 to about 6% over the last 20 years. In other words, researchers tell us that this decreased score is due to poor scores for blood pressure, blood cholesterol, blood sugar, also call that blood glucose, and BMI, or body mass index. And so, if you think about that, basically 94% of you need to find out your numbers, and the sooner the better. Well, the 5 factors, I like calling them the ABCDEs that you need to know, are these. The A is A1C, the B is BMI, C is cholesterol, D is diastolic and systolic blood pressure, and the E is your estimated cardiac risk. And what I'd like to do today is just take a brief look at each one of these. You ready to go? Okay. The A of ABCDEs is A1C. I tell my patients, think about ABC, but substitute a 1 instead of the B. So instead of ABC, you get A1C. And the A1C is a blood test. It's also called the glycated or the glycosylated hemoglobin, and it's an estimate of your risk of prediabetes or diabetes. It tells you your average blood sugar for the previous 2 or 3 months. A high blood sugar, also called a high blood glucose, could mean that you have or that you're heading towards diabetes. And untreated diabetes leads to many, many serious medical problems. Just a few: heart disease, heart attacks, stroke, premature death. In fact, the Harvard School of Public Health says that of all the leading risk factors for premature death, for preventable early death, high blood sugar is number 5. Killing 190,000 Americans each year. Smoking, of course, is at the top, but at least for what we're talking about, the A1C, the blood sugar, is a big deal. So, the American Diabetes Association recommends regular screening for diabetes starting at age 45, with repeated tests at least every 3 years. But I agree with, in fact, I practice the recommendation of the U.S. Preventive Services Task Force, and they recommend starting at age 35. And the main reason that they lowered it is because this epidemic of overweight and obesity that we have that's leading to more and more diabetes. So starting at age 35 with repeated tests at least every 3 years, starting at 45 with tests every 3 years is what the American Diabetes Association recommends. But let's go with 35. Now, here's a little wrinkle you need to understand. If you have any risk factors for cardiovascular disease, like high blood pressure, high cholesterol, physical inactivity, or smoking, well, in that case, you should be screened earlier. And for children or adolescents who are overweight or obese and have a couple of risk factors, they should be screened. So if you're under age 35, but you're overweight or you're obese, or you have at least one additional cardiovascular risk factor like smoking, high cholesterol, physical activity, high blood pressure, then you need to talk to your family doctor about having an A1C screening at least every 3 years. Now, some doctors will do a finger stick or a blood sugar, blood glucose test, either random or fasting, and that's okay, that's acceptable, but these only tell you what your blood sugar is at one instance in time. The A1C will tell you what your average blood sugar is for the last 2 or 3 months, and that's the one that I like, and I use it for virtually all the adults in my practice who are over age 20. Why? Because most of us have one or more risk factors for cardiovascular disease. So that's the A. Well, the B of the ABCDEs is BMI. That stands for body mass index. That's based upon a calculation that takes into account your height and weight. And there are many, many, many BMI calculators on the internet. And your BMI will show you whether you're underweight, normal weight, overweight, extremely overweight, obese, or fatally or morbidly obese. And this is a big deal here in America. About 1/3 of adults are obese. Over 70% of us are overweight or obese. And unfortunately, our children are following in our footsteps. Going back to that study from the Harvard School of Public Health, they say that of the risk factors for premature death, that of the leading preventable risk factors, if we look at overweight obesity, it's number 3 at killing 216 Americans a year. It's a big deal, literally, pun intended. Well, the C of the ABCDEs is cholesterol. Now, cholesterol is a waxy substance. Your body uses it to protect nerves. It makes cells, produce hormones. Your liver makes all the cholesterol your body needs. And your body also gets cholesterol directly from food, like eggs and meats, saturated fats, dairy products. And you need to understand that there's both good cholesterol and bad cholesterol. So let's briefly look at that. The LDL cholesterol stands for low density lipoprotein. That's the bad cholesterol. It delivers cholesterol to the body more than we need, into the walls of your arteries where it can build up and it can do damage. And the higher your LDL, the higher your risk. That's why I call LDL cholesterol lethal cholesterol. Now, that's the bad news, but there's some good news. And that's the HDL, the high density lipoprotein. This is the good cholesterol because it removes cholesterol from the bloodstream. The higher the number, the higher your HDL, the lower your risk. And that's why I like to call HDL the healthy cholesterol. Now, if your total cholesterol is high because of a high LDL, because of a high lethal cholesterol, then you're at higher risk for heart disease, higher risk for heart attack, higher risk for blood pressure, higher risk for stroke. But the opposite of that is if your total cholesterol level is high because of a high HDL, a high healthy cholesterol, you're actually at lower risk for these problems. So you want your HDL to be high and your LDL to be low. And the blood test that most doctors use to measure your total cholesterol, your HDL cholesterol, your LDL cholesterol, and another bad blood fat called triglycerides is called a lipoprotein profile. And the typical profile will include at least a total cholesterol, your LDL cholesterol, your HDL cholesterol, and your triglycerides. So how do you get all this checked? Now, follow with me. I'm going to try to go slow because it's kind of complicated, but I'm going to make it simple for you, okay? So first of all, the American Heart Association recommends a lipoprotein profile be taken every 4 to 6 years, starting at age 20. But another national group, the U.S. Preventative Services Task Force, recommends lipid testing with men starting at age 35 and women starting at 45 years of age. But there's a big but. That's only if you have no cardiovascular risk at all. What if you do? Well, they recommend testing for all adults with any cardiovascular risk starting at age 20. And since most of us have cardiovascular risks, such as being overweight or obese, a sedentary lifestyle, smoking, I recommend starting lipoprotein testing at age 20. And checking it no less than every 5 years. And you may need to be tested more frequently if your family physician determines that you're at even greater risk for heart disease or stroke. So, to sum up, starting at age 20, a lipoprotein profile every 4 to 6 years. American Heart Association, I like that. Starting at age 20 for men and women at increased risk for cardiovascular disease, and then every 5 years. And if you're one of those fortunate people that doesn't have any risk, then starting at age 35 for men and 45 years of age for women, and then every 5 years. So that's the C. The D of the ABCDEs is diastolic and systolic blood pressure. Now, the American Heart Association recommends that all adults 20 or older get their blood pressure checked at least once every 2 years, as long as it's below 120/80. Now, the U.S. Preventative Services Task Force is close. They recommend starting at 18 years of age, and that's what I recommend also. So for high blood pressure screening, starting at age 18 to 20, I say 18, All adults should have their blood pressure checked once every 2 years if it's below 120/80. Now, the upper number is called the systolic blood pressure, and the lower number is called the diastolic blood pressure. If your systolic blood pressure is 120 or above, or your diastolic blood pressure is 80 or above, you should have your blood pressure checked more often. And this is so important. Let me show you why. The Harvard School of Public Health lists high blood pressure as the number 2 cause of preventable premature deaths. It only follows smoking, and it kills about 395,000 Americans every year. So high blood pressure, especially if you don't know you have it, particularly because it can be asymptomatic, can truly be a killer. By the way, almost all experts recommend that abnormal blood pressure readings be confirmed by obtaining blood pressure readings away from the doctor's office. Like, for example, with home blood pressure monitoring before you start any treatment. And why? Because merely being in the doctor's office or in a medical facility raises some people's blood pressure. And so what I'm doing in my office now is what's called ambulatory blood pressure monitoring, where if someone has blood pressure that's up more than once, I'll actually have them check their blood pressure at home. Now, your doctor can do this fancy with ambulatory blood pressure monitoring. You can also do it with one of the cuffs that you buy at a health food store or at Walmart or Costco. They're surprisingly accurate, and your doctor will appreciate having those numbers. Now, I'm not going to get to the E yet because I want to talk a little bit more about these ABCDs because they make up what the U.S. Preventive Services Task Force, that's an independent panel of experts in primary care and prevention, and the American Heart Association, along with other national groups like American Academy of Family Physicians, we're all calling the ABCDs the 4 numbers you need to know. And the reason we lump these 4 together is because they're part of a common and very dangerous diagnosis called metabolic syndrome. It's a set of risk factors for heart disease and premature death that includes high blood sugar, that's our A, being overweight or obese, that's our B for BMI, having a high cholesterol, that's our C, and high blood pressure, that's our D for diastolic and systolic blood pressure. Now, what makes metabolic syndrome so evil, so insidious, that it typically does not have any recognizable symptoms until it's too late? I can't tell you the number of folks that have come to my office not having had a preventative checkup for years. We do the checkup, we find out that 2 or 3 of these factors are sky high. The damage has already occurred. And this is one case where preventative medicine is really good medicine. The metabolic syndrome includes high blood pressure, high blood sugar, excess body fat, particularly around the waist, and abnormal cholesterol levels. And it dramatically increases your risk for heart attack, heart failure, and stroke. By the way, aside from a large waist circumference, most of the disorders associated with metabolic syndrome, like I said, have no symptoms whatsoever. Now, the number of Americans who are being damaged, like the patient I just told you about, by not knowing or treating their ABCDs is literally staggering. The CDC reports 39 million of us aren't taking the recommended medication, the statin drugs, to manage our cholesterol. 40 million Americans are living with uncontrolled high blood pressure. Most of them don't even know they have it. More than 100 million have poor blood sugar control and likely have diabetes or prediabetes. And more than 170 million of us are overweight or obese. The number of Americans being damaged by not knowing or treating their ABCDs is just amazing. And you may well be one of them. And it's simple to do this. It's inexpensive to do this. It's easy to do this. Any family doctor or preventive medicine doctor can help you do this. And most of you, many of you need to do this. In fact, the CDC tells us that 13% of adults haven't checked their blood pressure. At least of those over 35 years of age. 18% haven't had a cholesterol check or a lipid screening. 36% of Americans haven't had a diabetes or an obesity screening. So it's just dramatic how many of us hadn't done it. It's something that's easy to do. It's inexpensive to do. And if you haven't done it, like 94% of you haven't, now's the time to schedule it. Now's the time to get it done. Although most people, I think we all know that some of these factors can increase our risk for disease and for premature death from cardiovascular disease and diabetes and cancer and other health problems. Most of us don't know how they're linked together and how we should all be evaluated for each of these. But now you do know. And I hope you'll get yourself, your family, your loved ones screened. And let me give you, because so many of us are people of faith, let me give you a recommendation that you may want to consider. And that is joining together with the pastoral professionals at your church or your faith community, joining together with health professionals in your community to set up a once or maybe twice a year health fair at your church or at your faith community, and having these 4 things done, the ABCDs of becoming highly healthy. But I like to add a 5th one. It's the E of the ABCDs, and that stands for evaluating your 10-year cardiac risk or your cardiovascular risk. So before we finish, based upon the national guidelines that are available, let's add this 5th risk factor, this E, to our ABCDEs. The U.S. Preventative Services Task Force now recommends a calculation of your 10-year cardiovascular disease risk in all adults aged 40 to 75 years of age. And there's a bunch of cardiovascular risk calculators that are available on the internet. The one that's used by most physicians and it's most available on the internet is called the Framingham Risk Score. It estimates your individual risk of developing potentially deadly coronary heart disease in the next 10 years. It's the E, but you use your A, B, C, and D to get your E. So let's sum up. Here's my recommendations for you. We've talked about a lot of complicated stuff. Let's see if we can make it easy. So at age 18 to 20 years, begin blood pressure testing, all of you. At 18 to 20 years, be sure you know what your BMI is and recheck it every couple of years. And at 18 to 20 years, my recommendation is that you have lipid testing, the lipoprotein testing, at least every 5 years. Now, include an A1C, blood sugar test every 5 years if you're overweight, if you have additional risk factors such as smoking or high blood pressure. If you're normal weight, at age 35, add A1C testing every 3 to 5 years. And then finally, at age 40, add that E, that cardiac risk scoring. I call them Dr. Walt's ABCDE screening recommendations, quickly to review. 18 to 20 years of age, blood pressure testing and BMI calculation at least every 2 years. 20 years of age, lipoprotein testing at least every 5 years. 20 years of age, blood sugar testing with an A1C every 3 to 5 years. If you have additional risks like smoking or high blood pressure or sedentary activity, your doctor may even want to check that more often. 35 years of age, blood sugar testing if you have a normal weight. And don't forget that evaluation of cardiac risk, the E, at 40 years of age. So, a quick review. Not one of you wants to die prematurely, right? But 94% of you are at high risk to do so because you don't know your ABCDEs. So do you remember them? The 5 factors, the ABCDEs, let's go over them once again. A is your A1C, that's your average blood sugar. B is the BMI. C is the cholesterol. D is the diastolic and systolic blood pressure. E is the estimated cardiac risk. The ABCDEs of highly healthy cardiovascular health. Now, if you're normal, your health vehicle passes inspection, then you're ready for a smooth journey down the road of life. But if one or more of these factors are abnormal, then you're due for a tune-up. And that's exactly what we're going to talk about in future editions of Ask Dr. Walt. Well, we need to close our time, and I hope you'll drop in next week when I'll be telling you about the keys to boosting your immune system and helping it fight off colds and influenza and maybe even coronavirus. But if you're interested in reading more about today's program, there are 2 of my books that you might want to consider picking up at my website, drwalt.com. The first is the book Fit Over 50. I think the title's maybe not as good as it ought to be, because all of the principles in here for becoming highly healthy apply to all adults. So Fit Over 50, making simple choices today for a healthier, happier you and a healthier, happier your family. And the second book is a republication of an old bestseller of mine that was called 10 Essentials of Highly Healthy People. I now call it 10 Essentials of Happy Healthy People, Becoming and Staying Highly Healthy. Both are available at drwalt.com. Also, if you have any questions for our future programs, then drop me an email. You can reach me at drwalt@liftabletb. We won't be able to cover all of your questions, but I do hope that we can cover many of them in future broadcasts. By the way, I can't answer specific questions about your health or your family's health, but I'm delighted to answer general questions that apply to all of us. Well, that's it for this week, but until next week, to quote the Apostle John, dear friend, I pray that you may enjoy good health and that all may go well for you, even as your soul is getting along well. I'll see you next week for more Ask Dr. Walt.